I'm here with Dr. Anne-Marie Albano, Associate Professor of Clinical Psychology and Psychiatry at Columbia University, and the Director of the Columbia University Clinic for Anxiety and Related Disorders. Thank you very much for being with us.
Thank you.
So today we're going to talk a little bit about depression in children. So my first question is, if a parent is worried about their child's behavior or emotions, how can they find out if their child actually has depression?
Depression is pretty insidious. That is, it's a slow-moving disorder that the child is headed on a downward spiral, and it's hard for parents to notice it. And part of the reason is because the child gets irritable. It's not as simple as adult depression where you withdraw from the world, you're crying all the time, and you take to bed. With children, you see irritability that starts, and a lot of times parents chalk that up to an age or stage that their child is in. So watch for irritability as that moves along. The other thing that starts happening is that depression usually onsets in adolescence. Now, sometimes you have childhood depression, 9 or 10 years of age. And what you're going to see is that your child will stop doing things they used to enjoy doing. Again, you might think, well, he doesn't want to be on the Little League team anymore because he's 12 now. Well, why wouldn't he want to be on the team at 12? They stop engaging in activities that used to bring them pleasure. They get really down in the mouth. Everything is negative. Why should I bother? Nobody cares. And so you see a lot of negativity, and their self-esteem starts to plummet. So they'll make statements that you might hear, I'm not good at anything. So you look at irritability, dropping out and loss of interest and pleasure in activities. You look at statements that, that they feel worthless or not good enough at things. The future won't change. They're kind of hopeless and pessimistic. You see that and might hear that. And of course, the thing we always really worry about and look for is whether they're saying things like, life isn't worth living, why the heck should I bother? Which, get towards when the depression is advancing and kids feel, suicidal. And parents get scared about that. So you'd look for behavioral and emotional changes that are lasting more than a couple weeks, 2 weeks, 3 weeks, 4 weeks. They're not simply a matter of stage and age, all right? And the thing a parent has to do is check with a pediatrician, check with a child psychologist, child psychiatrist, someone who can evaluate what's going on here and help them make a decision about getting some help.
So speaking of getting help, what treatments for depression are evidence-based?